Welcome, everyone, and thank you for being here. I will give a brief introduction into medical astrology, and I'll be less than 15 minutes. In surgery, success achieved through guesswork is just luck. The exact same principle applies to medical astrology. It's not enough to simply notice patterns or make loose associations. True skill lies in understanding the deeper origins of an imbalance and knowing how to guide someone responsibly towards lifestyle support. The gift of this work isn't just seeing connections, it's interpreting them with precision and care. Today, we're exploring medical astrology in a very grounded and responsible way. Medical astrology is not just about the physical body, it includes the psychological and emotional landscape as well. It is a holistic system that recognizes that thoughts, emotions, and physiology are deeply interconnected. This approach is about recognizing patterns rather than diagnosing disease. We are observing tendencies, how stress, emotion, and behavior may manifest in the body over time. Medical astrology must always be practiced within ethical boundaries. Without medical training, it is essential to work alongside qualified healthcare practitioners. Otherwise, we risk unintentionally causing harm. This is one of the most important parts of this work. Medical astrology must never replace proper medical care. Without medical training, it is essential to stay within scope, refer when necessary, and avoid making definite health claims. Otherwise, we risk causing harm, often unintentionally. One of the greatest responsibility in this field is language. If we tell someone we see a disease, we may unintentionally plant a physiological seed or a psychological seed. This can activate anxiety, hypervigilance, and even psychosomatic symptoms. Modern medicine recognizes this through the placebo effect, where belief alone can create measurable physiological change. So, our role is not to predict illness, but to guide awareness without creating fear. The body tends to express stress in consistent ways. Many people experience reoccurring patterns, digestive issues, inflammation, fatigue. Astrology helps us understand why those patterns repeat. And once there is awareness, there is the possibility of conscious change. Each individual has inherent sensitivities, certain systems that are more reactive or vulnerable. The birth chart can reveal where those tendencies lie. Stress impacts the body, emotional states affect physical health. Chronic patterns develop over time. Medical astrology simply gives us a symbolic map of these tendencies. It helps us see where we are more sensitive, how we respond to pressure, what kind of care actually works for us. Here we can see the astrological medical body map. Many of you may already be familiar with this. This helps guide us in a powerful way in understanding how the patterns will present through the human body. Planets have rulership over systems and body parts. There is some overlap between Western and Vedic astrology rulership assignment and some distinct differences. That is a topic for another presentation. The first house, we have 12 houses in astrology. The first house is the physical vessel, the baseline vitality, and the head. The sixth house is daily maintenance, acute illness, and how the body handles stress. The eighth house, deep-seated, psychosomatic, or psychological imbalances. And the 12th house, chronic or hidden conditions that develop silently beneath the surface. Houses show where experience manifests in life, not just physically, but psychologically. This gives us a pattern, not a diagnosis, but a meaningful story about how the body may respond under stress. If someone has strong Mars influence in their chart, they may push themselves too hard. experience inflammation or burnout, have a strong drive but struggle with rest. The goal is not to suppress Mars, but to regulate it. That might look like structured physical activity, learning when to stop before exhausted, releasing stress through movement instead of internalizing it. At this point, we are keeping things simple. Where Mars is in the birth chart and which other areas, Mars aspects shows where in the body this is presenting. If someone has a strong Saturn influence, they may experience fatigue or depletion, feel pressure or heaviness on the body, tend toward chronic patterns if they overextend. For them, the work is consistency over intensity, gentle discipline, long-term care rather than quick fixes. So you can see this becomes very practical. Let's say someone has a strong moon influence. A sensitivity for them can be linked to digestion and fluid-related issues. This person may notice that stress immediately affects their stomach. Emotional overwhelm leads to physical symptoms. From a medical astrology perspective, we would not say something is wrong. We would say the emotional body and physical body are closely linked. So the work becomes emotional regulation, creating safety in the nervous system, slowing down when overwhelmed. This shifts the focus from fear to understanding. You may know about the constitution or temperaments. I won't go deeply into this. Please note this is a wonderful way to give some guidance or understanding a person's general patterns. The constitution can be understood through the four elements or the dasha system used in Ayurveda and Vedic medical astrology. In the Ayurveda system, illness is linked to ignoring your body's signals. Your body communicates when you are overworking or not resting. Eating incompatible or unsuitable foods, staying in unhealthy emotionally or relational patterns. Your body will also communicate when you are overstimulating the senses through excessive feeding of any desires. Remember, it takes time for illness to present itself. Imbalanced habits catch up with us. There is a season for everything, and this means in certain environments or climates, it is highly advisable to adjust your diet and lifestyle habits to live in harmony with it. Ignoring circadian rhythms means not allowing your body to sleep when it needs it. You need sleep for repair and healing at deep levels. Natural aging processes are happening, and we should adjust our lifestyle to compensate for that. All of these factors can lead to Agni disturbance. This means digestive and metabolic dysfunction. In addition, this leads to Ama formation. This means toxicity increases in the body, especially due to undigested residue. Healthy digestion is critical to health. Our solar plexus or digestive fire is an important player in maintaining health. We need a healthy digestive fire, not too vigorous and wild, and not a weak, flickering flame. Looking at the birth chart helps us see this all. You may already be aware that medical astrology has a role in determining more suitable times for surgery. As an example of precision, medical astrology traditionally plays a role in choosing ideal times for elective procedures. For instance, we avoid operating on a body part ruled by the sun and moon is currently transiting. So like avoiding head surgery when the moon is in Aries. Ideally, we look for a waning moon to decrease fluid complications, but let me be entirely clear, emergency surgery should always be immediately supported. We never use this tool to create fear. A positive, supportive mindset is one of the greatest assets for post-op healing. Identifying the constitution through a medical or health lens can be especially helpful in guiding clients in diet, exercise, and lifestyle. Always remember, if illness is presenting, it can shift what would be recommended. Then recommendations are adjusted according to current experiences the client presents. On a side note, medical astrology can work alongside chakra understanding, herbal medicine, Ayurveda, and most modalities of healing and medicine. This presentation is an introduction to medical astrology. We are highlighting the main pillars in this talk. There are other layers such as planetary aspects and the subdivisional charts. Subdivisional charts are used in Vedic astrology to assist in medical astrological insight. For our purposes, we can see a lot with just the birth chart. The key is looking for patterns. In finding the patterns, it helps to know which planets rule which parts of the body when we are wanting to be very precise. That would be a more in-depth talk. There are systems in the body that involve organs and parts. For example, the cardiovascular system is made up of the heart, arteries, and veins with blood. The respiratory system is made up of the lungs, nose, mouth, and throat. Each organ and part of the body has a planetary ruler. All body parts are made up of cells, and cells are further made up of cellular components. So we do not have to be caught up in that. Understanding the body through a holistic perspective is important. Your body is working with you, not against you. It is constantly communicating. And when we begin to understand its patterns, we move from reacting to responding consciously. And that is where astrology becomes empowering. Thank you for listening, and I hope that this has been insightful.